Hi, I'm Carla Angelica Pasmaicoto. I'm going to talk about Ribavirin for chronic hepatitis E virus infection in transplants recipients. Definition: Hepatitis E is a liver disease caused by the hepatitis E virus, or HEV. The virus has at least 4 different types. Genotypes 1 and 2 have been found only in humans. Genotypes 3 and 4 circulate in several animals, including pigs, wild boars, and deer, without causing any disease and occasionally infect humans. The virus is shed in the stools of infected persons and enters the human body through the intestine. It is transmitted mainly through contaminated drinking water. Usually the infection is self-limiting and resolved within 2 to 6 weeks. Occasionally, a serious disease known as fulminant hepatitis, it means acute liver failure, develops, and a proportion of people with this disease can die.
Hepatitis E is RNA virus. Spread by the fecal-oral route. Incubation period 3 to 8 weeks. Common in Central and Southeast Asia, North and West Africa, and in Mexico. Causes a similar disease to hepatitis A, but carries a significant mortality, about 20% during pregnancy. In general, hepatitis E is a self-limiting viral infection followed by recovery. Prolonged viremia or fecal shedding are unusual. In acute infection, IgM antibodies to hepatitis E virus are positive. Does not usually cause chronic disease. A vaccine is currently in development, but is not yet in widespread use. Thank you for watching. For more videos,
So now let's meet some patients so we can put to work what we have learned about hepatitis E diagnostics. Our first patient is Hannah. She feels sick and had to vomit at home. She's feverish and her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So what's your diagnosis? Hannah has no history of immunosuppression. So let's take a look back at the graphic dealing with immunocompetent patients. Her ALT is very high, which signifies serious liver damage. Anti-HEV IgM and IgG are both positive, and we could detect RNA in Hannah's stool. Based on these results, we can conclude that Hannah is most likely in the early phase after infection. So Hannah is suffering from an acute hepatitis E infection. Let's see our next patient. Our second patient is Pete. He suffers from abdominal pain of recent onset. In the lab report, we can already see elevated liver enzymes. Pete received a lung transplant 8 years ago. Currently, he is on immunosuppressive therapy. Furthermore, he tells us that he's a passionate hunter. Based on Pete's history, we include hepatitis E screening in our lab report. We can see that his liver enzyme function is significantly elevated. His anti-HEV antibodies are negative. However, the lab detected HEV RNA in Pete's stool. What does that mean? Since we know that Pete is taking immunosuppressive medication, we should consider this in interpreting his lab results. We know that immunocompromised patients can have problems producing antibodies to the virus. So in Pete's case, it is essential to measure RNA. His lab report shows elevated ALT levels as a sign of liver damage, but negative antibody tests. However, there is RNA detectable in his stool. Pete is suffering from an active, ongoing HEV infection. Based on the laboratory findings, we cannot determine when Pete was infected. It may have been recently or more than 6 months ago. However, it is not important to know that. What is important is that Pete gets appropriate treatment and follow-ups. Congratulations! Now you can handle hepatitis E lab results.
So I hope you like this video.
Applications in medicine. There is not established the therapy for hepatitis E virus infection, but multicenter studies show that Ribavirin as monotherapy may be effective in the treatment of chronic HIV infection, and a 3-month course seems to be an appropriate duration of therapy for most patients.
Hepatitis E virus, referred to as HEV, is a common cause of sporadic and epidemic acute liver disease in developing countries. In the United States, sporadic cases of both imported and locally acquired HEV infections are mostly seen among adults. Incubation ranges from 15 to 60 days following exposure, with an average of 40 days. Liver enzyme elevation, as shown in blue and labeled ALT for alanine aminotransferase, usually occurs 4 to 5 weeks after exposure to HEV and persists for 3 to 13 weeks. Symptoms noted by the purple bar occur when liver enzymes are elevated. Virus excretion in stool, illustrated by the orange bar, is variable, but usually lasts from about 1 week before symptoms appear until about 1 week after they have surfaced. However, this time frame can be longer in some people. Viremia in acute self-limited infections, shown by the green bar, can be detected about 3 weeks following exposure or a week or so prior to onset of symptoms and lasts for about 2 weeks. Antibodies to HEV, both IgM anti-HEV, depicted by the pink hatched line, and IgG anti-HEV, illustrated by the black hatched line, are usually positive about 3 to 4 weeks after exposure. IgG anti-HEV persists, but IgM anti-HEV declines rapidly during early convalescence and is usually negative by 13 weeks. HEV serologic testing in persons with acute hepatitis, for which other causes have been ruled out, may be performed, especially in someone who has recently traveled to an area where HEV infection is more common. Chronic HEV infection is rare, but has been increasingly recognized in immune-compromised patients. Immunoassays to detect anti-HEV are commercially available, but are not FDA approved. Nucleic acid tests for the detection of HEV RNA are performed in research labs, but are not commercially available. This segment is now complete.
Hello, my name is Julianne Justo, and today I'll be reviewing pertinent drug information for SARS-CoV-2 as it relates to ribavirin. The mechanism of action of ribavirin is rather interesting. It's a guanosine analog that's phosphorylated inside the cell by adenosine kinase, and this results in metabolites of ribavirin monophosphate, diphosphate, and triphosphate. These metabolites can then go on to have both direct and indirect actions inside the cell. So direct actions regard inhibition of RNA polymerase, which results in chain termination, inhibition of RNA capping activity for the virus, as well as lethal mutagenesis of the viral RNA genome. Indirect mechanisms of action include inhibition of inosine monophosphate dehydrogenase, or IMPDH, which lead to a depletion of guanosine triphosphate, or GTP, inside the cell. It also seems to have an immunomodulatory effect and enhances T-cell mediated immunity in favor of T helper type 1 cytokine profiles, which can help combat certain viral infections. Overall, this leads to a mechanism of action where ribavirin is known for having relatively broad spectrum antiviral activity.
Pros and cons. Pros. HEV infection is generally associated with self-limited acute hepatitis without persistence of latent virus in hepatocytes. Cons. HEV genotypes 3 and 4 might develop into chronic infection in solid organ transplant recipients, leading to cirrhosis. The main side effect of ribavirin is anemia that requires reducing the dose, use of erythropoietin, or blood transfusion. Issue applied in medicine in Ecuador. Ecuador is an endemic area and it's responsible for a quarter of all cases of acute hepatitis as in other countries. Conclusion. Ribavirin as monotherapy may be effective in treating chronic HEV infection. A 3-month course seems to be an appropriate duration for this therapy, so a longer therapy can be given to heavily immunosuppressed patients and those who still have viremia 1 month after the initiation of therapy. Thank you very much.